BrainCore neurofeedback therapy begins with a comprehensive evaluation. This evaluation includes a quantitative electroencephalogram or Qeeg evaluation. During this evaluation, we are able to read and record brainwave patterns at 12 different sites in the brain. Our software then identifies where the brainwave patterns are abnormal, and then the neurofeedback protocols that we use are designed to specifically address those patterns that are abnormal in that particular patient. So for instance, if a patient is producing too much beta waves, the neurofeedback protocol for that patient would be to teach them how to produce less beta waves. And we do that through operant conditioning or a learning modality. A good example would be where the patient is hooked up to the computer using wires that are pasted to the scalp. It's completely non-invasive. There's no pins, there's no needles, it's painless. And those wires are basically just reading the patient's brain waves coming from their brain. The computer software then is going to reward the patient when they're producing the correct brainwave pattern. So, for instance, the reward might be a DVD that the patient is watching. They could be watching a movie, and the movie is either going to play when they're producing the correct brainwave patterns, or stop when they're not producing the correct brainwave patterns. This is simple operant conditioning. Over time, the brain learns that if it wants to see the movie, it's got to produce the correct brainwave patterns. The brainwave circuitry is then reestablished in the brain, and the new activation patterns that have been produced by the brain can now be used out in the normal environment. So now the child who was in the classroom falling asleep is no longer falling asleep, because they know now how to produce more beta waves and less theta and delta.